Knee pain and regeneration. Dealing with knee pain the ARTC way. What is ARTC? ARTC is the Age Reversal Technology Center. We bring a variety of effective health restoration technologies together to create programs that support our clients in overcoming various health challenges and achieving their health and performance goals. ARTC was created by the Nutrition Ninja Doc. Who is the Nutrition Ninja Doc? That's me. I'm the Nutrition Ninja Doc, Maximus McLeod. I've made finding innovative solutions to people's health challenges my primary mission in life. I've spent a lot of time in school, earning 3 postdoctorate degrees in the health sciences, including a Doctor of Osteopathic Medicine, Doctor of Naturopathic Medicine, and a PhD in nutrition. I've been studying health, nutrition, fitness, and natural therapy since 1969 and practicing since 1980. I've helped thousands of people in my career and maintain an ongoing commitment to continuing learning and finding more and better ways to help people heal. Why are knees so important? Well, they're standing, walking, running, bending down, sitting down or standing up from a seated position, getting to the ground or getting up from the ground, going up or down stairs, getting into or out of a bathtub, riding a bicycle, getting into or out of a car, many self-care activities, many work-related activities, kneeling to pray, and last but not least, they participate in being intimate with others and procreation itself. As with so many things, we take our knees for granted until they're damaged and painful. Knees are amazing biomechanical creations that allow us to do all the things just listed and much more. Can you imagine life without knees? Losing the function of one's knee or knees is one of the most debilitating things that can happen to a person, and in most cases, it does not have to be. The abilities and freedom that our knees provide are essential for our mobility, happiness, and our very survival. Luckily, these marvels of construction are designed to last a very long time, a lifetime if we take proper care of them. Unfortunately, far too many people either fail to properly care for the knees or have an injury that sets their knee or knees on a downward spiral of degeneration. Chronic degeneration and the incidence of knee arthritis, osteoarthritis, and degeneration. Knee osteoarthritis is the most common cause of musculoskeletal pain and disability. It results in major disability and pain in affected individuals. It's a chronic degenerative disorder due to many factors, including acute and/or chronic insults from normal wear and tear, age, obesity, and joint injury. It affects about 1 in 8 adults worldwide. Premature aging can be directly related to damaged, painful knees. When we lose our ability to walk without pain, we become increasingly sedentary. Being sedentary leads to a loss of muscle, strength, and endurance. This is directly correlated with early aging. That's why it's vital to maintain or regain the healthy functioning of your knees. Far too many people delay getting their knee pain properly evaluated and corrected. They accept the garbage can diagnosis of arthritis, thinking there's nothing they can do about it. Pain and anti-inflammatory medications only mask the pain, while accelerating degeneration. This goes on for years while the joint gradually degenerates to the point it becomes impossible to reverse the damage, and they're then advised to have a knee replacement. How does this make any sense at all? Seriously, who wouldn't want their knee bones shaved down to make it easier to install some beautiful shiny new knee hardware, as these illustrations depict? Knee replacements have come a long way. However, do not assume that your new artificial knee will work nearly as well as your God-given one. You should also realize that replacing the knee joint will not fix the other soft tissue structures that are often damaged and causing your knee pain. We regularly see people who are still in pain after they've had a knee replacement. Another major thing to consider is that a typical artificial knee only lasts about 15 to 20 years. If you outlive your new knee, and it needs to be redone, that can be a very messy proposition. This presentation is designed to help you understand the knee joint, the major types of injuries and damage that occur, and what you can do about it to prevent needing an artificial knee. You were put on this planet with all the parts you need to live a long, healthy life. However, It is your responsibility to take proper care of those parts. We are not cars where we can go to the mechanic and replace parts and expect to be as good as new, although many people apparently treat their bodies that way. Our bodies can regenerate with proper support. Let's look at the major structures that make up the knee. This diagram shows the right knee from the front with the kneecap removed. The femur is the thigh bone. The tibia is the primary bone of the lower leg. The fibula is a secondary bone of the lower leg that helps to provide greater function. The cushions between the femur and tibia are called menisci. There are medial and lateral parts to it. There are four main ligaments that provide stability yet allow movement. There's also cartilage that covers the bones to provide added protection and ease of movement. Not shown are the synovial sacs and bursa that also provide protection as well as smooth, almost frictionless movement. Here's a side view of the knee and the key structures that make up the knee, thereby allowing it to do all the amazing things that it does. This illustration is also of a right knee. It includes the kneecap, ligaments, cartilage, menisci, and a partial view of one of the 9 muscles involved along with the patella tendon or ligament. There are quite a few muscles involved in the knee, far more than most people realize. Directly involved are the rectus femoris, vastus medialis, vastus intermedialis, vastus lateralis, biceps femoris, semitendinosus, semimembranosus, sartorius, and popliteus. However, all of the muscles shown below play roles in proper, efficient knee function. Here's a quick review of the main muscles that extend or straighten the knee. The quadriceps muscles. These consist of 4 large muscles on the front of the thigh. They include the rectus femoris, vastus lateralis, vastus intermedius, and vastus medialis. Their main function is to straighten the knee. They all originate on the thigh bone or the femur and join together at the kneecap and ultimately connect to the lower leg, the tibia, via the patella tendon. Here's a quick review of the main muscles that flex the knee. The hamstring muscles. These consist of 3 large muscles on the back of the thigh. From outer to inner, they are the biceps femoris, semitendinosus, and semimembranosus. Their main function is to bend or flex the knee. Additional muscles of importance to the knee. These consist of the gluteal muscles, including gluteus maximus, medius, minimus, and the piriformis, as well as the tensor fasciolata, also known as the iliotibial band, the gracilis, and sartorius. Some other additional structures of importance include the ligaments of the lumbosacral region, the pelvis, and the hip, in addition to a few additional muscles. Any one of these can refer pain down the leg and into the knee. There are 3 categories of common causes of knee pain. 1, there are acute injuries from things like sports, impacts, falls, or car accidents. 2, there are chronic overuse or repetitive motion injuries from sports, working, exercising with either poor form or by overstressing the joint. And there are systemic conditions or whole body conditions that affect the knee, like arthritis, osteoarthritis, gout, osteoporosis, etc. Acute knee injuries. Acute knee injuries are very common. There are all kinds of ways that one can injure their knee in sports or daily activities by bending, twisting, impacts, etc. It can also be caused by a direct blow to the knee, but most injury occurs due to an event leading to abnormal twisting, stretching, or bending of the knee. Acute injuries to the knee result from taking the joint through a greater range of motion than it can tolerate, thus stressing the various connective structures of the knee. What structures tend to get damaged with acute knee injuries? Well, muscles and tendons get strained, they get pulled or torn. Ligaments get sprained, which means they're overstretched and or torn. Menisci get compressed, frayed, and or torn. Bones can get fractured. Nerves get damaged. Various blood vessels can be damaged, arteries, veins, and capillaries. MRSA can be involved by swelling and inflammation, and often it's a combination of the above that'll be injured at the same time. Chronic overuse and repetitive motion injuries are even more common and can be just as debilitating. Overuse injuries occur due to repeated or prolonged pressure on the knee. Activities like skiing, biking, jogging, or jumping are a few examples of causes of overuse knee problems. These activities can cause repeated stress on the joints that lead to irritation and inflammation of the knee. All the same structures can be impacted as in acute injuries: bone, ligaments, bursa, nerves, blood vessels, muscles, and tendons. Some common overuse injuries can lead to the following: bursitis, which is inflammation of the small fluid sacs that cushion and lubricate the knee. Tendinitis is inflammation of the tendons. Tendinosis is actually small tears in the tendon attachments. Plica syndrome is a thickening or folding of the knee bursa. Patellofemoral pain syndrome is pain in the front of the knee from overuse, injury, excess weight, or problems in the kneecap. Ligament damage, overstretching from repeated minor sprains. Degenerative and systemic body-wide conditions that can cause knee pain. Arthritis, this is the biggie. It's a huge trash can diagnostic category that has over 100 different types, is poorly understood, and generally has ineffective treatments. It's also the #1 cause of disability in the United States. Osteoarthritis is the most common form of arthritis, affecting millions of people worldwide. It occurs when the protective cartilage on the ends of bones wears down, leading to degenerative changes. Autoimmune conditions. Rheumatoid arthritis, gout, and lupus can also cause knee pain, swelling, stiffness, and degeneration. Baker's or popliteal cysts. These are fluid-filled cysts that cause a bulge and a feeling of tightness behind the knee. This typically results from a problem with the knee joint or a cartilage tear. Both can cause the knee to produce too much fluid, which can lead to a Baker's cyst. And then there's septic bursitis, inflammation or infection of the small sacs of fluid that cushion and lubricate the knee. Whether it's an acute or overuse injury, the most common knee injuries are to ligaments and their attachments. The knee has 4 primary ligaments: the medial and lateral collaterals and the anterior and posterior cruciate. Damage to the medial collateral and lateral collateral ligaments are by far the most common injuries. When a ligament is stretched and damaged, it will typically only heal back to 50% of the original strength and be a bit longer. This means the joint will be looser or sloppier than before the injury. This leads to accelerated wear, tear, degeneration, and pain. Additionally, the muscles will attempt to compensate, which further exacerbates the pain, inflammation, and degeneration. In the vast majority of cases, a significant sprain injury will not heal back to full strength or the original length. So this bears repeating, as it's very poorly understood, even by physicians specializing in joint injuries like orthopedic surgeons and chiropractors. When a ligament is sprained, it typically only heals back to 50 to 75% of the original strength, and it will be a bit longer, even just a millimeter or so longer than it was before the injury. This causes the joint to be less stable or looser than it was. This in turn creates messages to the brain that the joint is not stable. The brain does the only thing it can do to try and protect the joint and maximize survival potential. It tells the surrounding muscles to tighten up to help protect the joint. There's a price to pay for these chronically contracted muscles. Muscles are not designed to stay in a state of chronic contraction. When they're forced to do so, they begin to malfunction, and that is what causes most of the pain, inflammation, and joint damage over time. These chronically contracted muscles lead to chronically inflamed tendon attachments, formation of neuromuscular trigger points, and excessive wear and tear on all of the structures, including the menisci, the cartilage that covers and protects the bone, and the bone itself. The muscle imbalances also tend to create or contribute to misalignment of the joint, which also accelerates the damage and degeneration. All of the damaged structures must be addressed, including the ligaments, muscles, tendons, nerves, menisci, cartilage, and bones. Although there are many therapies that can help alleviate the muscle contractions and neuromuscular trigger points that form, they will not fix the damaged ligament, so the aberrant messages will continue to activate the muscles, creating a vicious circle. Therefore, the ligaments must also be treated. That's what's missing from most approaches. Not everyone needs the more aggressive ligament repair techniques, but we have them for those that need them. Another structure that is often damaged is the meniscus. Ligament damage and or muscle imbalances, in addition to traumas, can cause the meniscus to become damaged, frayed, or torn. Depending on the type of tear, surgical intervention may be necessary. However, if it is only frayed, compressed, or there's a minor tear, there are a couple of non-surgical approaches that can be used to help repair it. This is where shock wave and regenerative injection therapies using various specialized solutions come into play. As you can see, there are many different things that can cause either acute or chronic knee pain. We simply can't go into the details of all of them here. The important thing to realize is that all of them can be regenerated with the right approach. What's important to note is that the underlying cause of the pain, 90+% of the time, has to do with damage to the soft connective tissues, primarily ligaments, with compensation by the surrounding muscles that leads to the pain, inflammation, and degeneration. It's crucial to identify the damaged structures and assist the body in healing them. Fixing knee pain the ARTC way. Rule number 1 is to identify what's damaged. That's why it's so important to have someone with a lot of experience and expertise with knees and the entire musculoskeletal system to properly evaluate your particular knee problem and recommend appropriate restorative care. The sooner this is done, the better. The longer you wait, the more degeneration there will be, and the harder it will be to fix. How do we address knee problems at the Age Reversal Technology Center? The first step is to do a proper evaluation to determine what structures are damaged. Next, a treatment plan is developed to address and help your body to heal the damaged structures. We use a combination of several wonderful therapies combined in a very specific way to help your body heal itself. We also do things to reduce the pain as much as possible while the area is healing. We use a combination of joint decompression, muscle rebalancing, joint realignment, and shockwave therapy to support the muscles, tendons, ligaments, and other tissues. Knee joint decompression has been shown to reduce pain and inflammation by enhancing circulation, hydration, fluid exchange, nutrient delivery, healing, and repair. It also increases joint space, bone and cartilage repair and growth, joint range of motion, physical function, gait, blood supply, soft tissue healing, relaxation of the muscles, inhibition of protective muscle reflexes, and stimulation of dynamic contractions. It's also been shown to reduce depression in those with chronic knee pain and to restore lost brain neurons related to knee function and control. Knee joint realignment. If your knee is out of proper alignment, if the joint is not properly aligned, it will continue to cause excessive wear and tear and degeneration. It's surprising how many people's knees are not properly aligned. Whether from an injury or improper body mechanics, misalignment accelerates damage. We gradually work to put the joint back in proper alignment and rebalance the muscles and strengthen the ligaments to help it stay in alignment. Balance, re-educate, and retrain the muscles. The muscles perform many vital functions. They're also our primary tool to adapt to our environment. When joint structures are damaged, the muscles are called on to help compensate, thereby allowing us to adapt and survive. Once they're directed to adapt to an injury, they need to be rebalanced and re-educated to restore proper function. Shockwave therapy is one of the tools we use, and it has been shown to reduce pain and inflammation, break up scar tissue, calcium deposits, and neuromuscular trigger points. To stimulate circulation and tissue oxygenation, it also stimulates angiogenesis, which is the growth of new blood vessels. It stimulates collagen production. This is the protein that holds us together. It's vital to make sure all of the essential nutrients needed for the body to heal and repair itself are present. Our job is to support your body in healing itself. All healing is ultimately self-healing. The body needs all of the vital nutrients in ample amounts every day to heal from an injury. Most people do not consume all those vital nutrients in sufficient quantities, thereby impeding the body's natural attempts to repair itself. You are a bodybuilder when you're healing. Healing requires proper circulation to bring nutrients to the area, reduce pain and inflammation, and stimulate healing and regeneration. There are several things that we do to improve circulation to the damaged area that are crucial for proper healing and recovery. Home red and near-infrared light therapy is one of them. It does a lot more as well. We also utilize a special sleeve that enhances circulation all day long. A stable foundation for the foot is also vital to minimize abnormal mechanical stressors on the knee. With age, the wear and tear that typically goes along with various activities, everyone's foot arches tend to weaken and flatten over time. This creates increased mechanical stress on the ankle, knee, hip, and lumbosacral region. We include a high-quality arch support as part of our program to address this important consideration and provide a stable foundation. The ARTC program, we provide a structured program that incorporates all of these key components to maximize your results. When it comes to fixing a damaged knee, as with any joint, it takes the right combination of therapeutic modalities and other components integrated into a comprehensive program for optimum success. Healing takes time and consistent support. That's what our knee regeneration program provides. Your body has magical healing properties and potential that we can help to unlock. There are no magic therapies that are guaranteed to fix you, but everyone's body has a certain capacity to heal itself with the right support. Our specialty is putting together the right plan to activate and support your own magical healing response. You have to take the first step and meet us halfway. We pioneered the 4M's approach to understanding all chronic disease conditions, as well as the strategy to correct them. We also apply this to degenerative knee conditions. The 4M's are microcirculation, mitochondria, metabolism, and muscle, also known as metabolic reserve. Here's a quick diagram to illustrate the 4M's. So it shows that they all interrelate with each other. So the microcirculation, that makes up 99% of the entire circulatory system. That's what feeds our cells and the mitochondria while removing toxins. Now the mitochondria, a lot of people aren't familiar with them, but the mitochondria are subcellular organelles that account for up to 25% of cell volume. There are about 2,500 mitochondria per cell, and they provide energy. They make 95+% of the body's energy and are absolutely crucial for proper function of all of our glands, all of our organs, and for regeneration. Next, we've got metabolism. It's responsible for all the functions our physical bodies carry out throughout the day. It's the sum total of all electrochemical reactions that allow for life itself. And last but not least, we have muscle. People think of muscle mainly for its fitness or aesthetic benefits, but muscle is our largest and most metabolically active system. It is our primary metabolic reserve, and it also allows for movement. So when we look at the body and any kind of a health condition, we take the 4Ms into consideration and try to identify which of those 4Ms might be imbalanced and support them to maximize the healing response. There are two components missing from the 4Ms diagram, and they are the body structure itself and nutrition. The 4Ms do not operate outside of the body structure. They are part of the body structure and are interdependent with all the various tissues that compose our physical body. For this reason and many others, it's imperative that our body structure is sound. In fact, the whole point of this video is about helping to restore damaged knee structures. The structural integrity of all body parts, organs, etc., is vital since everything is connected and works together. The microcirculation is likewise part of body structure and is the only place that nutrient exchange with the tissues happens, as just mentioned. However, those nutrients must be available in the bloodstream. For that to happen, they must be ingested, digested, absorbed, and assimilated into the bloodstream. So our program works to support the 4Ms to maximize the healing response. Call today to schedule an initial consultation and examination to evaluate your knee pain. Whereas some of our programs can be done virtually, our knee restoration program typically requires in-office care once or twice a week for several weeks. If that's not possible, there are a couple of options that can radically accelerate the regeneration process for those outside of our local area using various biologic solutions. These would require coming to our office 1 to 4 times several weeks apart for those treatments. Here's our number. You can call 941-806-5511 to schedule an initial consultation and examination. We're located at 3226 Clark Road in Sarasota, Florida, and we've got a little map here for those that might need it. Addendum: comparisons between the ARTC knee restoration program and conventional approaches. Of course, the ARTC approach is not conventional. It's a progressive approach based on 40 plus years of clinical experience focusing on musculoskeletal issues. The following few slides are an attempt to put the ARTC program into perspective and to compare it with other options. We've created a simplified visual scale to quickly illustrate our beliefs and opinions regarding the relative value and efficiency and efficacy of various conventional approaches. The ARTC approach is up top with conventional treatments compared. So the basic ARTC program, we rated in the range of a 5 to 9 in terms of overall effectiveness, in terms of completely repairing the joint. Now, if you add regenerative injection therapies to the ARTC program, then we're pushing up to 8, 9, 10, complete restoration and regeneration. The most common thing that's used for knee pain are NSAIDs, non-steroidal anti-inflammatory medications. We rate those as a -3 to possibly a +1, but they're pretty much in the negative category because it causes further damage and degeneration. We'll talk more about that. Next, cortisone injections, very, very commonly recommended for knee pain. Again, well into the negative range, although it sometimes provides short-term pain relief, it significantly damages the joint. Hyaluronic acid injections, we'll talk more about in a minute. They've got some good potential, very temporary, but good potential. And the standard physical therapy can be quite helpful when done appropriately. Here's a little more detail about each of those. So NSAIDs. They've been used for decades as the mainstay for all kinds of aches and pains. First off, they're harmful both to your joints and the rest of your body. To make matters worse, they do not work well for moderate to severe pain, although they will reduce inflammation. The problem is that appropriate inflammation is crucial for proper immune system function, as well as regular healing and repair processes. When you shut down the beneficial controlled inflammatory response, you shut down healing, repair, and maintenance of the entire body. Each year, the side effects of long-term NSAID use cause nearly 103,000 hospitalizations and 16,500 deaths. More people die each year from NSAID-related complications than from AIDS and cervical cancer in the United States combined. Here's the reference. Additional details about steroid injections. Again, pretty negative in terms of the overall effect. So steroid or corticosteroid injections have been used for a variety of painful inflammatory conditions for decades. They're quite powerful and can help to reduce pain and inflammation associated with inflammation for a limited time, sometimes dramatically so. However, they also are quite harmful to a variety of tissues and actually speed up the degenerative processes. That's why the doctors that use them are very strict about how often and how many times they will do them for a given joint. They literally degenerate and disintegrate the joint. Details about hyaluronic acid injections. There's several brands, including Synvisc, Synvisc 1, Trivisc, Durolane, Supparts, FX, Genvisc, and others. Your body makes hyaluronic acid. It lubricates joints, among other things. It's remarkable stuff. It's injected into damaged joints to temporarily add joint lubrication, thereby reducing joint pain. It does help many people for up to 6 months, and then it can be repeated. However, it does not halt the progression of degeneration. By kicking the can down the road, people delay doing something that can help to regenerate the joint and make its own hyaluronic acid. The score of 1 to +5 is because it is quite temporary and delays people from taking more definitive actions. Results and relief do vary significantly. Next, how about physical therapy? Well, let's talk about standard physical therapy. That's what most people are going to find. It has good potential when done properly by a skilled therapist, depending on the tools they use. But good luck finding one with the right skills and equipment. Sadly, since PTs rely heavily on third-party payers, private insurance and public Medicare, they have to stick with what the powers that be allow. They also have to see quite a few people every day to make ends meet. This often means going through the most basic PT procedures and hoping for the best. Some of the top, more progressive PTs may incorporate light therapy, shockwave therapy, and knee decompression devices. However, they are extremely rare. Details about acupuncture. Acupuncture has good potential when done properly by a skilled acupuncture physician. However, it too is limited. Acupuncture works primarily by opening blocked energy pathways that help the body to heal while also reducing pain and inflammation. If, however, the tissues are significantly damaged, it may not be enough to help restore damaged structures. Some of the top, more progressive acupuncturists may incorporate some other modalities, including a modified form of regenerative injection therapy. However, their license does not allow them to utilize the various stronger substances or biologic solutions like stem cells or growth hormone. Details about massage. Massage has good potential when done properly by a skilled massage therapist. However, massage is quite limited when it comes to fixing a knee. Massage works primarily on the muscles and to a much lesser degree on the tendons and barely at all on the ligaments. And while it can do a great deal to assist the muscles and you do feel better, it will be temporary if there's deeper tissue damage. If ligaments are damaged, the muscle tightness and trigger points will return after a short period of time. This will require regular massages indefinitely, but will still not repair the deeper damaged tissues. Details about chiropractic. This has good potential when it also incorporates the other modalities previously discussed as part of the ARTC program. Of course, those things are not really chiropractic at all, although some progressive chiropractors do utilize them. Some chiropractors also affiliate with MDs and DOs to provide some of the regenerative injection therapies previously discussed. But again, that is not chiropractic. Chiropractic itself is quite limited in what it can do for a damaged knee other than to realign it if that chiropractor has had additional training in extremity adjusting, since that is not included in basic chiropractic training. Details about regenerative injection therapy, and you see all by itself we give it a rating of 5 to 9, and we've seen complete resolution in a number of cases as well. Regenerative injection therapy has excellent potential all by itself when done by a skilled physician that is thoroughly based in musculoskeletal medicine and also incorporates the other modalities previously discussed as part of the ARTC program. Once again, it's very rare to find someone that really knows how to do regenerative injection therapy. Even harder to find one that also incorporates the other modalities as discussed. All by itself, RIT does have great potential to help the body heal the damaged tissues like ligaments and tendons. However, that will not address the muscles, bursa, circulation, nerves, or menisci. All of these structures must be addressed appropriately to facilitate proper healing and a full recovery. And that's the reason that we only rated up to a 9 and not a complete 10. Another thing in the addendum is insurance, health, personal injury, and workers' compensation. The question is, who is responsible for your health? Who should make your health-related decisions and choices? If you said you for both of them, you're correct. Unfortunately, far too many people leave their health-related decisions up to someone else, their doctor, the insurance company, whatever the insurance company will pay for, or their spouse. You are responsible for your own health and healthcare decisions. Health insurance companies, including Medicare, simply do not know about every new innovative treatment available. They focus on covering the current standard of care. Anyone that knows how dismal the state of America's health is would not rely on the standard of care. Given the fact that health insurance, including Medicare, generally does not pay for regenerative care, and what we do is regenerative, we do not accept insurance assignment. However, we can provide you with appropriate invoices to submit to your insurance company for reimbursement. Our focus is on helping your body to heal. Spending hours a day on the phone with insurance providers, submitting bills, following up, resubmitting, etc., are the reasons healthcare costs have gotten so exorbitant and the actual healthcare has gotten so bad. Our focus is on you. Let us help your body to repair itself as efficiently as possible. That requires you investing in your health. Final remarks. As often happens, I get a bit carried away and tend to provide too much information. That's my nature. I figure I'm going to cover a subject, I might as well cover it fairly comprehensively. This video did a good job of covering most of the key basic information to help you understand knees and the many types of problems that they can develop. Now it's up to you to do something about it. We stand by, ready, willing, and able to assist you on your road to better health and functioning. I'd love to tell you how fast, easy, and cost-free the process will be, but that wouldn't be true. It's going to take a significant amount of time, effort, and money to get your knee or knees back to full function.